And we'll begin our second and final panel, consisting of representatives from veteran service organizations and nonprofit organizations that are on the ground walking women veterans through the toughest of transition challenges. I'd like to highlight that the majority of our witnesses on this panel are here with us for the first time. First, can we transition over to, here we go, starting to see some of our witnesses for the second panel. Hopefully they're all on. I'd like to welcome you all and thank you for your time here today and your dedication to our nation's heroes. First, we have Ms. Jodie Grenier, Chief Executive Officer of the Foundation for Women Warriors. Nice to see you. For Lady Veterans Connect, we're joined by Ms. Phyllis Abbott, Founder and Executive Director. Hello. Though not for their first time, but always grateful for their participation, we have Captain Lori Manning, Director of Government Relations for the Servicewomen's Action Network. Hello there. And last but certainly not least, we have Ms. Ginger Miller, President and CEO of Women Veterans Interactive. Thank you all so much for joining the subcommittee today. With that, I'd now like to recognize Ms. Jodie Grenier for 5 minutes.
Chairman Levin, Ranking Member Moore, distinguished members of the subcommittee, thank you for inviting Foundation for Women Warriors to testify today. Foundation for Women Warriors is a 101-year-old nonprofit organization dedicated to serving women veterans and their families by empowering their future through programs that enhance their personal and economic well-being. Women are serving in the military in record numbers and represent 10% of the veteran population. As women increasingly serve our country, they face a myriad of issues when they decide to end their service. As such, women veterans, as compared to their male counterparts, are the fastest growing segment of homeless veterans. They have a higher unemployment rate, lower median income, and are more likely to live below the poverty line. They are also more likely to be single parents, yet are less likely to have the same support network. The four main areas that impact successful transition from our perspective include access to gender-specific healthcare and programs, limited financial planning, limited job readiness, and the transition assistance program's inability to effectively collaborate with organizations that meet needs and fill gaps for veterans. Overwhelmingly, women service members and veterans report that there's still little information shared on how to apply for VA healthcare and disability benefits during TAP, and that they receive either little or no information on women's specific healthcare. While the VA recently launched the Women's Health Transition Training course, it is online and it has not been widely advertised, and it is listed as optional. Online programming often fails to answer any specific questions a service member may have, and service members report that if a course is not mandatory, military commands often will not allow service members to attend. Service women can be better served through comprehensive financial education and planning that addresses the fiscal realities and challenges of transitions. With nearly 40% of service women as mothers and 11% as single parents, women veterans face inordinate financial challenges after service. TAP fails to express the reality of family budget planning, childcare costs, insurance, and pay gaps after service. In addition to the limited financial education and planning, transitioning service members face delays in benefit payments, making budgeting a challenge. Veterans report that they're surprised by the delay of their final paycheck, as well as post 9/11 veteran GI Bill benefits. This only compounds as women veterans in all age cohorts earn significantly less than male veterans and suffer from higher unemployment rates than their male counterparts. Our veterans report that TAP employment curriculum is geared towards government and DoD contracting jobs and offer little insight on ways to gain employment in the private sector, failing to highlight employers across broad industries. Women veterans also specifically report not feeling comfortable asking questions that pertain to childcare, benefits, or negotiating salary in these predominantly male classes. While we understand that no one program meets all the needs, TAP offers little information on other veteran serving organizations that are able and ready to meet the gaps of transitioning service members. Instead, many military installations have created a pay-to-play system in which they've created an additional cost to provide transitioning service members with much-needed services. In other cases, accessing service members becomes so bureaucratic, lean nonprofits forgo the burden. Foundation for Women Warriors presents the following recommendations for your consideration. We would like to see expanded the Women's Health Transition Training course to ensure all transitioning women have access to gender-specific resources and make this mandatory. Ideally, this should also be offered in person. Develop strategic collaboration between the Department of Labor, TAP, DOD, and veteran organizations to address and remove gaps in services. Reduce the financial vulnerabilities by increasing funding and access to effective and comprehensive financial literacy within the active duty military. Research the childcare needs of veterans to determine the feasibility of a GI Bill childcare stipend to provide affordable and quality childcare. In closing, I want to thank the subcommittee for your commitment to improving the transition of our nation's women's veterans to civilian life. We're eager to assist you in your efforts in any way we can, and I'm available to respond to any questions you may have. Thank you.
Thank you very much, Ms. Grenier.